Hi, my name is Matthew Gloin, and I'm a chiropractor in Los Angeles, California at LiveWell Chiropractic and Pilates Center. And this week's video blog, I just wanted to talk about why some people experience injuries in certain areas of their body and how they may treat them. A lot of patients will come into my office for care that relates to a back issue or a neck issue. But oftentimes, once I examine them, I find that the problem doesn't actually exist in the neck or the back. That may be where they're experiencing the pain, but the problem exists in another part of their body because they may lack flexibility or strength in those areas, which thus causes overuse of the area where they're feeling the pain. For example, someone may come into the office with shoulder pain, such as a pitcher who is bounded and determined to throw a ball at 100 miles an hour. And once we look at the shoulder, we find out that there is a tear in the shoulder or there's some sort of sprain strain going on, and that they're going to need treatment in that shoulder. But the patient is often concerned about, how do I make sure that this doesn't happen again once I get rid of this initial bout of pain? And what we usually find is that in an example like that, the pitcher may not have good hip flexibility or core strength, and as a result, when they're trying to create the momentum of throwing the ball, they're overusing the shoulder, which causes the tear to occur. So it's important to treat the injury, but it's also really important to figure out what the cause of the pain is. So I want to just talk a little bit more about shoulder injuries specifically. And a really common one that people come in with is impingement syndrome. So the shoulder joint is a ball and socket, and on top of that ball is a lot of muscles that are attached. And those muscles help to lift our arm up or down or in various directions. The shoulder is a really amazing joint because it's able to move in 1,000,001 different directions. But that's because there isn't much holding it in place except for those muscles. So those muscles all need to be working together in order for the shoulder to work properly. Most times when people come in, it's because those muscles that make up the rotator cuff aren't working together properly, and as a result, one of the muscles may start doing more work, changing the way that that ball and socket operates, and consequently they may get swelling or pain in the shoulder. If you are someone who has pain when you're sleeping on that side, or even worse, if you're not even sleeping on that side and you still have pain in the shoulder, that's a sign of inflammation in most cases. So the best thing to do is to get examined first to figure out what specific muscle or ligament or issue is going on in the shoulder, and then figure out from there what direction to take. It may mean that therapy can start right away with rehab exercises, chiropractic care, acupuncture, massage, or if it's unclear as to what's going on, you may have to get some other imaging done, such as an MRI, an X-ray in some cases. And with that full picture, then you can decide what would be the best choices. In today's healthcare world, it's not a matter of, is there something that can be done? It's more a matter of what should be done based on what is going on with the person at the time. So I encourage you, if you have a complaint, to get it examined fully. We at LiveWell Chiropractic and Pilates Center try our best to do that, and we try to work together as a center with all the therapists here, and we speak to one another about the best sort of treatment to help that person as they're getting their care. Thanks for the time, and hope to see you soon.